This is CNBC.
And I'm Sue Herrera. Welcome to Money Tonight.
Almost every day we hear about the high cost of health care, but what if we told you that as much as 10% of what you and your employer and your insurance company pay doesn't go to health care at all? It goes to fraud. Consumer health editor Steve Gundel is here with the details on that. That's surprising.
And you know what? We spend $90 billion each year on health care. Now, that means we're talking about hundreds of millions of dollars in fraud and abuse that can happen because the system is so complicated. It's possible to hide fraud and abuse within the mountains of paperwork. But tonight, we want to show you a company that's tracking down medical fraud to help keep you healthy, wealthy, and wise. Picture the scenario. A woman goes into labor preparing for a normal delivery. Conditions change and the doctor performs a cesarean section instead. And then the doctor bills the insurance company for both a vaginal and cesarean delivery. Same woman, same baby, same time.
Approximately $3 million in this initial review that we found.
The accounting and auditing firm Deloitte & Touche says the story of the C-section double billing actually happened and is just one of the millions of dollars worth of fraud and abuse incidents that face local governments, insurance companies, and private corporations.
We have never, ever found less than 2%. So if a large corporation is spending, let's say, $100 million, we can easily guarantee a $2 million either recovery or identification.
You're certainly right that we shouldn't be paying for the second one.
Teamsters Union Local 560 in New Jersey is one of Deloitte & Touche's newest clients. Although the Teamsters benefit funds carefully review medical claims themselves, and insurance companies may audit and review hospital bills, overbilling may not show up on any single claim. That's how doctors get away with it. But if you look at bills for large numbers of doctors over several years, then patterns of abuse begin to emerge. Such as the $1 million orthopedic surgeon Deloitte & Touche uncovered near Colorado. He was performing procedures that were not required. That doesn't show up on paper until you look at his total bills.
This particular orthopedic surgeon billed $1 million when everybody else in his peer group was billing $200,000 to $300,000. That's a lead in itself.
And then you caught him.
And then we caught him.
Here at the Teamsters Union, in New Jersey alone, eliminating fraud could save $250,000 to $300,000 a year. Were you surprised at the amount?
Yes, I was. That I didn't think we'd find some of these things. I think the funds could be saving money, and I think the providers will be put on notice. And enough people do it. Maybe we won't have the abuses we have.
Deloitte & Touche says over the last 10 years, they've saved more than $600 million in money that had been spent on health care, but never bought an ounce of cure. Now, if you're wondering, much of this is beyond those of us who are consumers because often we don't even see the large bills. They just be sent away, processed by computers. But if you get a bill from a hospital, for example, go ahead and look it over for mistakes. I have one friend who, after the birth of a child, was billed for a circumcision. The child was a girl.
Oh, my goodness.
Come on.
Yeah, it really happened.
That's amazing.
Yeah.
Now, if the bills are standardized, Steve, that brings up the issue of how can the doctors then, bill you for more?
Well,
one of the
tricks is called unbundling. They take something like an appendectomy, for example, okay, which has one cost, but if they break it down into its components, they charge you separately for laparoscopic surgery, which is just the incision, and so on. They can end up building a whole big charge, and it doesn't show up anywhere unless you take a look at the whole big picture.
As long as you're here, what happened with health reform in Washington today?
Oh, some big turn of events. The House Ways and Means Subcommittee is going to be the first to start writing a bill. They're not going to start with the Clinton legislation. They're going to start with their own. They want to scrap those health care alliances. They say nobody wants them, so starting from scratch. So
Back again. All right. Thanks very much. Okay.